By the end of this, we're projecting that we're going to do 100,000 shots. There is no way we could have done this without our volunteers. And I think for a lot of people in Louisville and in Kentucky, I think this was something that just really made them feel like they were able to make a big difference in our community and really impact the world around them. There was nobody that said, this is about me, right? Everything is about the community, about the group. Sometimes people were leaders, sometimes they were followers, right? We had doctors out here directing traffic.
I'm a retired physician, and as my wife was doing this, she said, you should come out here and do this too. You'll really enjoy it. And I signed up and started working here, and she's absolutely right.
I retired actually 17 years ago. It really gave me new purpose that I didn't expect to get, because this is my first volunteer attempt, and now I feel like I'm going to embark on a lot of volunteer work, so that's a good thing.
This was just a really amazing experience for a lot of reasons, but it really was because people truly came together and worked as a team to solve these problems.
Hey, everybody. What a way to start a Thursday update, showing our incredible volunteers that are out there all across Kentucky working to get people vaccinated. On behalf of the Commonwealth, thank you to each and every one of you for giving your time for other people, for again showing us what it's like to be selfless and doing what it takes to protect your neighbors and your friends and even people you don't even know. Let's start today with some good news. Earlier this afternoon, I was in Richmond at Madison Central High School to help launch an exciting initiative that will boost education while helping to train our workforce for the jobs of the future. In a fitting announcement for Earth Day, Happy Earth Day, school leaders and officials with App Harvest launched a container farm classroom where students will get hands-on experience working with state-of-the-art, ecologically focused technology. App Harvest, of course, is a major Kentucky success story of the last year. Even during the pandemic, CEO Jonathan Webb and his team have been busy rewriting the rules on how to sustainably produce food for a growing world at their massive Moorhead operation. And I went and saw what is going to be a massive Richmond operation just the other day. In Moorhead, Jonathan and his team have built one of the biggest indoor farming operations anywhere, using the most advanced LED lighting system, I believe, that has ever been created. App Harvest also recently became the newest publicly traded company in Kentucky, and it's exciting that that newest publicly traded company is in Eastern Kentucky. They're already producing huge amounts of tomatoes, which are being shipped to market all across the Eastern Seaboard. With this container farm classroom, App Harvest is making good on its promise to be something more than just another company, or what we mean talking about Team Kentucky, using their resources to prepare our kids for the future. One of the great things about Jonathan and App Harvest is they're committed not only to building their company here, but also to growing Kentucky, to ensuring that we lead in this post-COVID economy in the area of AgriTech, and that those good jobs are right here in our backyard. This is just what this project does. App Harvest Container Farm Classroom will offer Madison Central High School an advanced curriculum that's going to have these kids. I met 4 of the main FFA students ready for the technology of the future, and it's going to give them so much hands-on experience to be ready for those jobs that are already here and only more are coming. This is how we build a new industry. These were our FFA students, and they actually had grown, as you see here, some of the leafy greens already. There is no substitute for this type of hands-on education. That is how we're going to lead in AgriTech, and these are the students that are going to help get us there. All right, next, school safety. I started my term as governor with an emphasis on improving education, but that was not limited to only what happens inside the walls of our children's schools. So on Wednesday, I announced a $23 million investment to fund 70 highway safety projects targeted near our schools to make them safer. A third of Kentucky counties will be the site of transportation improvements to improve safety, traffic congestion, and connectivity near schools. Investing in transportation is investing in the quality of life for Kentuckians. Think about how much time you spend dropping off or picking up kids from school. Projects like building dedicated turn lanes into entrances of schools are going to help improve access, but also ensure we don't have wrecks right there in front of schools with our most precious cargo, our kids. It's also going to improve traffic flow along main roads for people's morning commutes. In Western Kentucky, funding will be allocated this year to begin designs for new turn lanes at Pride Elementary in Hopkins County that will significantly improve afternoon traffic flow in and out of the school. Pedestrian safety improvements will also include replacement of sidewalks with the turn lane project area, upgrading sidewalk ramps to be ADA compliant, and restriping the crosswalks. In Central Kentucky, a sidewalk project near Nelson County, near 2 Bardstown city schools, will be the site of more than $500,000 of investment to improve connectivity between KY 245 and Templin Avenue. This phase is part of the city's comprehensive plan to expand multi-use paths and sidewalks in Bardstown. If you are a parent of a child that walks to school, projects like these new sidewalks are going to make you safer. And in the end of the day, what is our job in government if it's not to look at the places that our children are most often and to make them as safe as they possibly could be? I can't think of a better use of these extra transportation dollars than making sure our kids are safe. And whether that's our young Kentuckians that have just gotten their driver's license, or those that are being dropped off, or the buses that are pulling in and out, I'm really proud of how much safety these dollars are going to bring. This week has also been exciting for another infrastructure announcement. On Tuesday, I announced the investment of $5 million to revive worn roads across 32 counties and cities in Kentucky. Nearly 60 miles of roadway will be resurfaced, repaired, or built to support economic development. Good roads provide a smooth ride for commuters and support local businesses who rely on safe and efficient connections. I know at the local level, transportation improvement dollars are stretched thin, and the rounds of severe weather we've faced has not helped our road conditions, in some instances even stripping every bit of blacktop away. For some counties, this funding is the only way they can afford critical resurfacing work. For some cities too, like Morgantown, this is going to allow a key access route into the city's largest industrial park, thus giving us the opportunity to bring good jobs to that city and to so many others. This new funding infusion, coupled with last year's $17 million of discretionary fund investment, will make positive improvements across Kentucky. All right, another piece of good news last night and coming into today. So in 2008, the Commonwealth filed a lawsuit in Franklin Circuit Court seeking forfeiture of more than 140 internet domain names used by offshore companies operating gambling websites that were taking real money wagers from Kentucky citizens. Almost all those companies agreed to block Kentucky from their illegal gambling websites, except for one called PokerStars. In 2012, the Commonwealth brought a new lawsuit against the owners and operators of PokerStar websites. It was brought by Michael Brown, now the head of the Executive Cabinet, then Justice Cabinet Secretary. This was a lawsuit alleging one of the largest illegal internet-based gambling operations. Between 2008 and 11, more than 34,000 Kentuckians played a quarter of 1 billion hands of internet poker on PokerStar's illegal, unregulated gambling websites and lost more than $290 million in real money. As you know, we recently, in December 2020, had the Supreme Court affirm a judgment on behalf of the Commonwealth against PokerStars for $1.6 billion, and that amount is increasing with interest. We're asking that for the transfer of PokerStars trademarks to a new company be declared a fraudulent transfer, and for the Franklin Circuit Court to void the transaction. While we're waiting, though, when companies appeal a large judgment, they have to put up bonds. And those bonds are supposed to give security to the party that won to be able to collect. Well, Kentucky can now collect on $100 million of these bonds, which we have moved to do. The Franklin Circuit Court went ahead and ordered for us to be able to do it and for the $100 million to be transferred into our attorney's escrow account. PokerStars tried to take it to the Supreme Court to stop that, and they were denied. So we look forward by May 14th to receiving the first $100 million from the judgment in this case, and we will continue to pursue other recoveries. All right, moving into our COVID update, let's start with where we are on vaccines. Looks like table one right now, 1,696,530 Kentuckians vaccinated. Again, we believe this number is a little bit low based on some data issues we've been having. We also believe there's about 13,000 more Kentuckians that have been vaccinated in other states than we've vaccinated people from out of state, meaning our net number, if we looked at it, is a little bit higher than this, and that's in fact what the CDC shows. What that means is we got about 800,000 Kentuckians to go to hit our Team Kentucky Vaccination Challenge of 2.5 million Kentuckians. That'll provide us so much protection. We need to push hard to get there. If you look at table two, we got to do a lot better. You know, for a period of time, we were even up to almost 200,000 Kentuckians vaccinated in the week of March 16th. This last week, well, I think this is a little bit low. We show about 84,968 vaccines. Folks, what that means is we've got over 550,000 vaccines right now out there ready for you to get. It has never been easier. Nobody has to wait anymore. Anybody over 16 can get them. They have proven to be some of the most effective vaccines in human history. They basically eliminated death, and they've basically eliminated major sickness, and they have done it even in our most vulnerable populations. Early studies on the breakthrough rate, whether you can get infected once you've gotten the vaccines, 0.008%, meaning again, some of the most highly effective vaccines out there. If you're not vaccinated, looking at numbers in the population, of the United States, we've had one out of about every 550 Kentuckian. We've had about one out of 550 Americans, out of every 550 Americans, die from COVID. And that is incredible. It is a huge amount of loss, and we can end it. We can win this. And all we have to do is go out and get vaccinated. So we put out the call. We're asking our local officials. I'm going to be asking all of our business leaders. We need everybody to step up and say, now is the time. Let's make sure that we push through. Let's get fully beyond this. Let's get to a place we can drop each and every restriction. That's where we want to get to. So come on, get out there, get vaccinated. It's never been easier. It's in virtually every grocery store. It's in virtually every pharmacy. It is in your local health department. There is no excuse on access. It's now everywhere. All we need is you to go out and to get it. Now, if you're worried about it, get the information. Go to a trusted source. Why don't you call your doctor? Why don't you talk to any other healthcare provider that you trust? You don't have to take it from me, but reach out and at least have that conversation. And the reason that if you haven't been vaccinated, we need you to have that conversation is our variants continue to increase. Now with over 270 confirmed cases that include a variant, 250 of those are the B.1.1.7. That is the UK variant. And folks, this is infecting younger people and younger Kentuckians. If you're a Kentuckian, really 16 through 49, this is the group that is being infected by this variant, and more people are getting sick in this group than ever before. So please don't be casual with these out there, with the numbers you see and how they're growing. We need you to get vaccinated. Now, the good news is there's a heck of a lot of openings right now. Again, with with over 500,000 first doses waiting to get in people's arms, you can go just about anywhere. U of L Health, Cardinal Stadium, you can sign up right now for tomorrow. You can sign up right now for tomorrow and about any time. You could sign up right now for Friday, Saturday, other days in Louisville and get in quickly. Kroger Field at UK, same thing. Why don't you make the decision tonight? Why don't you go tomorrow morning? Let's get it done. St. Elizabeth in Northern Kentucky is ready for you as well. Can get you in on almost a moment's notice. Pikeville Medical Center, actually Pike County jumped out and became one of the most vaccinated counties, but a lot of the region around it we need to do better. We're going to start publishing vaccination rates by counties. That's already on the CDC's website. We hope to have that next week to show where we are, and I hope foster some healthy competition, because the more people who get vaccinated, the fewer people die, and I hope we all agree that that is a good thing that lives out our faith and lives out our values. Finally, Baptist Health Corbin, but the Baptist Health Center virtually all over Kentucky has open appointments. I believe tomorrow, but certainly by the end of this week or early next week, we are also going to announce 2 new FEMA vaccination sites, partnerships with FEMA. There's going to be one in the east and one in the west. It's going to also have vans that can get out in different parts of those communities to try to reach people where they are. FEMA is going to engage in a joint announcement with us tomorrow that will advise everybody where those are. They're going to be in areas where we haven't seen enough vaccinations. So we're going to hope that people will step up and get vaccinated. All right, our COVID report today, 628 new cases. Right now, we are just a little bit under last week. I think Dr. Stack will tell you he sees us at a plateau at the moment. We'd rather be decreasing, but a plateau is certainly better than starting to see a 4th wave. But again, if enough people don't get vaccinated with the variants, we will see an increase in cases. Probably won't look like the last waves because we've had a lot of people vaccinated, but it could be very harmful to our unvaccinated population. Today, the hospitalization up 23 from yesterday, ICU up 8, people on a ventilator up 3. We don't like to see those numbers go up, but we have a lot of healthcare capacity right now. Positivity rate down a little bit, 3.36%. It was good this week as we'd seen the positivity rate inch up, to see it kind of flatten and then go down just a little. We think, again, we're at a plateau there. But again, a real positive that we haven't seen it continue to increase. And this week we have 8 red counties. We are sad to announce 8 total new deaths. 5 have come up through the regular process, and they are all April deaths. So this is still killing people, folks. We're not out of it yet. And 3 are audit deaths. The new deaths from April are a 70-year-old man from Boone County, a 76-year-old man from Jefferson County, a 69-year-old man from Kenton County, a 78-year-old woman from Meade County, and a 58-year-old man from Pike. Folks, none of these people are in long-term care because so many people in long-term care have gotten vaccinated. And it shows you how well these work. On the audit deaths, they're all December deaths where it was so deadly. 57-year-old man from Campbell, 79-year-old man from Graves, 85-year-old man from Marshall. 2 of those are in long-term care. Both of them were before residents could get fully vaccinated. Again, we are seeing almost 0 people pass away in long-term care since we've done our vaccination program, which brings me to what used to be one of the toughest parts of the update, and now is one of my favorites. If we look on the long-term care facilities, 0 new residents testing positive today. 0. 5 new staff. Remember, fewer staff got vaccinated than residents, and now every day there's more staff testing positive. We have identified 2 new deaths. Those are from the audit that I just read that occurred in December that we have to add, unfortunately, to that total. All right, with that, I'm going to turn it over to Dr. Stack. He's got a couple of different updates, including discussing the nursing home that was recently, that we talked about previously, that saw some reinfection, and that became a paper and or a study relied upon by the CDC.
Thank you, Governor. Good afternoon. So I'm going to talk to you about 2.5 things. The first is an update on Johnson & Johnson. The second thing will be an update on the nursing home study. So for Johnson & Johnson, just to remind people, the Center for Disease Control's Advisory Committee on Immunization Practices is reviewing the data related to the very rare blood clotting disorder that appears potentially linked to the vaccination. They are meeting tomorrow to review any new evidence that has been made available and are anticipated to make a decision tomorrow about whether or not to lift the pause on distribution and usage of J&J in the United States. The European Medicines Agency has already lifted their restriction and has started to ship J&J again in Europe. And I think most of us anticipate that will happen soon here in the United States. I think it's really important that we put these things in context. The overall risk of this clotting disorder, even if it is associated with the vaccination, which is yet to be demonstrated conclusively, is 1 in a million. And with that, we need to put this in context. The governor has already said there's about a 1 in 550 chance of dying from COVID in the United States. If we look right here in Kentucky, you have about a 1 in 708 chance of dying from COVID compared to a 1 in a million chance of having any rare complication from the J&J vaccine. So in this context, where over 3 million people have died internationally, over 566,000 Americans have died, and over 6,300 Kentuckians have died from COVID, vaccines are, by relative comparison, incredibly safe, and they are our path out of this pandemic with the least harm caused. Now I'm going to talk real briefly on the long-term care facility outbreak investigation that was done after immunization took place. I'll just anticipate this. We generally don't release the facility names because the facility didn't do anything wrong. They participated and did all the actions they were supposed to do, and cooperated with the local, state, and federal public health officials, and we're very grateful for this partnership across all these partners. And we also try to respect the privacy of these individuals and these institutions to the fullest extent we can. But I've spoken on this multiple times. I'm just going to give you some other evidence from this nursing home instance that we studied right here in Kentucky. For the residents who were vaccinated, the vaccine was 66% effective in preventing infection. It was 87% effective in preventing infection with any symptoms, and it was 94% effective in preventing COVID-related hospitalizations. That's in the residents. Unvaccinated residents had a 3 times risk for infection compared to unvaccinated residents. Unvaccinated residents had a 3-fold increased risk for infection compared to vaccinated residents, and unvaccinated healthcare professionals had a 4 times risk of infection compared to vaccinated healthcare professionals. So the vaccine is incredibly protective, and right here in Kentucky, we have demonstrated the very same wonderful results that have been shown in other locations. My final point here is just to emphasize what the governor has said about the importance of the vaccines. The sooner we all get vaccinated, the sooner we can put COVID-19 and this pandemic in the rearview mirror and get back to our lives as close to the lives we formerly knew pre-COVID. Vaccines are highly effective and safe. I've already told you that based on our own comparison to the number of deaths relative to our population in Kentucky, there is more than 1,000-fold risk of death from COVID than there is any harm from vaccination. If you receive that in Kentucky, it is the safest and quickest path out of this pandemic. I hope everyone who has not yet been vaccinated will take the opportunity to do so quickly. There is plenty of vaccine available across the state. There are hundreds of thousands of doses in pharmacies and at hospitals and at health departments throughout the state, and we are continuing to expand the locations in the weeks ahead that have vaccine. Please, it is as easy as picking up the phone or going on the internet, or even maybe walking in the door and asking, do you have an available appointment, and getting vaccinated. If you remain uncertain, it is very important that you are informed. This is your choice. This is your choice to accept vaccination to protect yourselves and to protect your loved ones. Please be informed. Talk to people you trust and have confidence in. Talk to your doctors, your primary care providers. Ask them your questions. Address them to your level of comfort. And then please, I hope you'll consider getting vaccinated so we can all move on with our lives, put this behind us, and stop talking about this on a regular basis and focus on so many other things that are important to us. So thank you very much for all you've done so far. This is the final stop in the journey. Let's just get it done. Thank you. And I think Amy is going to talk to us now about unemployment insurance. So here comes Amy.
Thank you, Dr. Stack. Just a few updates for today. First, just to remind everyone that we have started our in-person appointments at the career centers. Things are going wonderfully. We've seen almost 4,500 people in our 13 career centers since those reopened last week. New appointments become available every day, and they open up at midnight, Monday through Friday. So be on the lookout for those if you're needing in-person assistance. If you have an in-person appointment, please bring 2 forms of ID with you so we can verify your identity. Unfortunately, we have to go to those steps because of the rampant fraud out there. If you want some information about the types of ID that we would accept, you can go to kcc.ky.gov, and we have a list there for you. And please remember, for now, these services are appointment only, so we cannot take walk-ins. Hopefully, once COVID is done, we can start getting back to the normal functioning of the career centers, but for now, you will need to make those appointments. A quick update about our PIN resets and our helpline. The last 2 weeks, we've assisted over 37,000 claimants on the helpline, but we do have over 102,000 people who have been able to register their new accounts. So obviously those PIN letters have gotten out. If yours hasn't gotten there, be patient. It should get there, and the instructions seem to be working. So if you are still needing to reset your PIN, the phone line is still available for a few more days, but those letters should be coming to you and should give you the assistance you need. And last, I know we have gotten some questions the last few weeks about the work search requirement. We are announcing today that we are reinstating that effective May 9th. Our UI weeks run Sunday to Saturday. So regardless of when you request benefits that week, you will be asked if you have complied with the work search requirement. You will be required to seek suitable full-time employment and report at least 1 attempt each week. It's recommended you keep a record of all your job contacts, including the name of the business, the title of the position, the name and title of the person that you contacted, the date and the method of contact, and you will be required to provide those details during your biweekly benefit request. You are allowed a reasonable period of time to find work that is comparable in pay and skill level to your most recent employment. If you're not able to find comparable work after a reasonable period of time, or if it's not available in your area, you can adjust that work search. And you may have to look for a job that may pay less or is located further away from your home. There is obviously more information about this on the kcc.ky.gov website. And again, this is a long-standing requirement that was waived for the beginning of the pandemic, but there are a lot of jobs out there to be had, so we are reinstituting this requirement. But you are not required to conduct a job search in a few specific situations. If you're a member of a union that finds work for you, if you're a student in a training program, if you are just laid off with a definite recall date within 12 weeks of your initial claim date, if you've got a temporary leave of absence, or if you have been part of a mass electronically filed claim, you are exempt from the requirement. So again, there'll be more information on this longstanding requirement at kcc.ky.gov. Thanks.
All right, we'll open it up to questions. We've got a large list of reporters and some written questions as well. Let's start with Stu Johnson from WEKU.
Good afternoon. Thank you, Governor. You were in Richmond today earlier to speak to graduates at the Criminal Justice Training graduation ceremony. are there needed in police training, and if so, in what?
Stu, you're cutting out. I don't know if that's our audio on our side. Can you try asking the question again, please?
Yes, sir. Can you hear me now a little clearer, or is
I can.
Okay. All right. So regarding the graduation ceremony today in Richmond for the police training, the graduates there, are there changes needed in police training in a program like at EKU or others across the state? And if so, in what areas?
Well, we've made significant changes in training, especially over the last year and a half. We have significant training on de-escalation, on, for lack of a better term, cultural awareness, trying to make sure we're addressing some real concerns that are out there in a way to where both law enforcement and our population where everybody can believe that we're working towards the same goals of safety. We've also made changes in our training materials, where we discovered some training materials that were anti-Semitic and/or inappropriate, also unprofessional. Everybody involved, from the commissioner there, Commissioner Gillick, to KLEC, are all committed, we believe, to doing this and doing it right, and knowing some change has been needed. What I saw from this graduating class are people who are dedicated, who are taking on this job knowing that they have to serve every single Kentucky citizen, and we're going to continue to work to ensure that again, we law enforcement serves each and every community, which I believe they do. I have a lot of respect for our men and women in law enforcement, and the fact that they leave their families every day to better protect ours. That doesn't mean there aren't things that we can do better. And what I'm excited about is leadership in Kentucky right now that is committed to doing better. Also, and I hope to have a report on this soon on the state police side, our new Office of Recruiting is getting some significant results on helping to diversify our training classes there. That's something we'll hope to see statewide. Just like teaching and every other profession, we need to make sure each of them look more like the communities that they serve. Karen Czar from WUKY.
Good afternoon. Hello, Rachel. I have two questions. One, Governor, have you gotten to review any more information in the incident between Louisville police and a demonstrator on Sunday? And if so, your reaction? And then also, as far as COVID-19 testing, how is the process going? Are you satisfied with the stats? And will more be closing as more people are vaccinated? Thank you.
Well, on the COVID testing front, we have fewer people than at the height of this being tested each day. Ours is certainly higher than many other states around us per capita, but it's going to be natural for there to be less testing as more people are vaccinated or more people have recently had COVID. So we've got to adjust our expectations. Right now, we think we have enough people getting tested to have an idea of where the virus is out there. And that's going to be a lot of what we have to rely upon. Again, we have enough to see where that positivity rate is, but we would encourage people out there, especially even if you're vaccinated, if you're feeling sick, get tested. Certainly use it as a tool to protect yourself. On the incident in Louisville, the chief of police there has already ordered a review, and I think that shows exactly how serious it is. Certainly, it's hard to look at pictures of that individual, of the bruising. It's concerning. And so I think it was right to want to get all of the facts. And I think that's exactly what, in this instance, LMPD is trying to do, and to do so promptly. Now, we need accountability in everything, and we'll need it as this moves through. This is a part of commitment to doing things right, and that's when concerning things pop up, you make sure that you have an open, transparent process that people can watch and know you're taking it seriously and know you want to get to the bottom of it. Chad Hedrick from WKYT.
Hi there, Governor. I wanted to ask you just about the number of cases in the younger population. We have seen a lot of counties that are reporting a noticeable increase there. In fact, statewide, the 19 and under population has the highest number of cases for the month with about 2,300. And then you can tell a noticeable decrease as you get towards the older populations. So how do you reach these late teens and early 20 age groups? Are there plans to going to maybe even getting into high schools? That way you can reach that 16, 17, 18 age group, or what is the plan to try and get the younger demographics?
Well, first, you're right in where cases are right now. Cases are in younger Kentuckians for two reasons. Number one, older Kentuckians are vaccinated at a much higher rate. We're now 74, 75% of Kentuckians 70 and up. That's great. We want to keep going. 60 and up is the next highest group in terms of overall percentage. And then we start falling off from there. The second reason is the B117, the UK variant, which we believe is the dominant variant everywhere now, is infecting younger people at a higher rate and is hospitalizing them at the highest rate that we've seen. We are trying to work with our school systems, especially 16 through 18-year-olds. There is, I believe, a clinic that's going to be done by U of L and Central High School. It's exciting to see those types of outreaches, and we're going to need to continue them. I know both nationally and on the state level, we're focusing a lot of digital advertising on younger Kentuckians. But this is something that we also need people to step up in their individual patriotic duty and their individual responsibility and get done. So many people from this age group have done the right thing throughout on this, have foregone opportunities, have worn masks, have done what they need to do to not spread this virus, and getting vaccinated is now that next step. Sure, it might not get you sick, but it can get that person that you can potentially spread it to sick. And whether that's somebody that is waiting to get vaccinated or has decided not to get vaccinated, we don't want any harm to come to them. We don't want any harm to come to anybody. So please, in that age group, which we're going to continue to work on, and we'll take any suggestions from anywhere, media and otherwise, we need you. We need you to get vaccinated. You're a big key. If you're 20 to 49 in Kentucky, you're a big key to helping us win this battle. John Boyle from WFPL.
Hi, Governor. Dr. Stack touched a little bit on the implications of the CDC study about the nursing home, and this could be a question for him and a question for you also. But I wanted to flesh that out a little bit and just hear about some of the lessons that you guys take from that, and if you would consider any policy changes as a result.
Well, certainly the lesson is get vaccinated. I mean, even in these breakthrough cases, which are really rare, when we look overall at what the CDC is showing, you are really protected if you get one of these vaccines. They are incredible vaccines. Now, that doesn't mean they're going to be perfect, and some people are going to get reinfected, but at a very low rate. But even there, it's showing that the odds of getting reinfected are low, and then the odds of getting sick if you're vaccinated are really low. But if you're not vaccinated, your odds of getting sick are much higher. What I think that means is our companies that run long-term care, our communities that run long-term care need to make an extra push to get their people vaccinated, show them real examples of the harm that could be caused. I think that's the case in many other areas too. I think we all have a responsibility to one another. And for me, that's one of the reasons to want to be vaccinated, to keep from spreading this to other people, to keep from spreading it to my kids when we were talking about, 18 and under. So with that, I'll turn it over to Dr. Stack.
Did you have a specific question on the nursing home study? Did I miss the lessons learned? Thanks, Governor. So as far as lessons learned, the lesson learned is the vaccines work. They work really well. So the CDC provided us some background as we went to do this. As of last week, on April 13th, there were more than 75 million people in the United States fully vaccinated. over 75 million people vaccinated fully as of last week. And during that time, that 75 million people were fully vaccinated, there were less than 6,000 breakthrough infections reported, okay? Less than 6,000 people that we are aware of who had breakthrough infections after vaccination. The statistics I rattled off before show that if you are vaccinated, the likelihood of getting sick drops dramatically, maybe as much as 2/3, as far as getting even symptoms or infected. It also shows that your likelihood of having death or serious illness resulting in critical care or serious hospitalization is incredibly lower. As far as policy changes, I think we've got pretty much directionally the right policies. We just need everyone in society to rally around this, to reassure people about the importance and the value and the benefits of vaccines. And we just need an all hands on deck approach. We need employers, businesses, physicians, educators, all of us to help pull together. People look up to you, they respect you as leaders, they value the work you do in society. This is the way we can get all these customers, all our friends back together doing the activities that we miss. So I think the lesson learned is vaccines really work. There's not going to be perfect at times, but boy, they are really good and they are really safe compared to taking your chances with COVID. So let's all get it done. Thank you.
All right, I've got a written question. The president mentioned wanting to have bigger gatherings by July 4th. What are my thoughts on the possibilities? We ought to be able to beat that. We ought to be able to have bigger gatherings much sooner than that. It's in our hands. Certainly in Kentucky, we're talking about no restrictions on up to 1,000 people. If we can just reach our goal of 2.5 million Kentuckians vaccinated, and we could do that in 3 weeks. Are we going to? Not at the current rate that people are getting vaccinated. Will we, even at the current rate, do it before July 4th? Absolutely. But it's in our hands, and we're not trying to set this goal to upset anybody. It's just basic math about how safe we are. And to be able to get together in groups that large really safely, that's amazing. And certainly there's a difference in being able to get together in a group that's large where it's unsafe and where it is safe. And so let's get there. Catherine Collins from WLEX.
Hi, Governor. What is your reaction to yesterday's report from the auditor on the unemployment insurance system? Have there been any changes made to prevent state employees from accessing their own claims? And also, is there any update on how much money may have been given to fraudulent filers?
Well, in regards to yesterday's press release on the audit, every piece in it has either been previously disclosed, was an investigation launched by myself and the Lieutenant Governor long before any audit, and or has already been rectified. In fact, a large part of the audit, and talking about what was paid out early on, we've already worked through with the Department of Labor and have their blessing in moving forward. It was caused by the U.S. Department of Labor originally saying, go, help people, it's a pandemic, move it quickly. And then about a month and a half later saying, whoa, we really didn't mean that. You should have been doing all the things that we said not to worry about and to move ahead. So I believe that we either have addressed or we are aggressively addressing the issues that are raised in it. I do hope in the future what we will see in these audits, though, is also the office is underfunded. I would have really liked to have seen in the audit when the legislature cut $18 million from the budget that you can't do this and have a sustainable UI office that's going to be able to address a sharp spike in claims. I would have liked to see in the state audit when 80 people were cut from UI, 80 employees that could have been processing claims and saying, wait a minute, times aren't always going to be good. You need a sustainable office. I would have liked to have seen in every state audit that this system is way outdated because an auditor recognizing a system that would be so susceptible to fraud because of its age and lack of upgrading. I would have liked to have seen that too, but we inherited the office we did. And we are working as hard as we can in unprecedented times to both help people and to do it right. Tom Latek from Kentucky Today.
Thank you, Governor, and good afternoon to you. Two questions. You or Dr. Stack can take this on. The fact that I am, for example, fully vaccinated and my 2 weeks was a week ago, is there any more need for me to be tested at all? And secondly, for someone who has not been vaccinated, maybe because they had COVID and figured they're not going to get it, are they more susceptible to the variants now?
So, Tom, if you've been fully vaccinated, get a test if you feel sick. Get a test if you're concerned about symptoms. I get tested regularly. Continue to. It's a choice that I've made as we work to come out of this pandemic, and also to continue to provide different data that can be used by the CDC. But certainly, it's reasonable if you've been fully vaccinated and you're careful and you're not feeling sick, to forego at least the amount of testing you previously had. Dr. Stack, he agrees. The second piece is, are you more susceptible if you haven't been vaccinated to the variants in the original strain of COVID? Yes. Yes, they're more aggressively spreading. If you haven't had COVID and you're not vaccinated, if you are exposed to this variant, you are more likely to get COVID than if we went back in the beginning of the pandemic. Now, fewer people should be carrying it because of vaccinations and because of antibodies. But if you are an unvaccinated person getting together with a large group of unvaccinated people, then this is a more aggressive virus that can spread very, very quickly, which raises your risk. It's also harming people at a higher degree and at a younger age. So get vaccinated. We're seeing incredible outcomes of those that especially have had Pfizer and Moderna, and J&J too, though there's that 1 in a million chance. Alex Akisto from the Herald Leader.
Hi, Governor. I have two questions. The first, last time an update was given on correctional facilities in Kentucky, I believe more than 70% of people housed in jails and prisons had been vaccinated. The goal was to vaccinate at least 80% before visitations could resume. I know that's on pause because of the Johnson & Johnson vaccine. Do you have any plans to replace those remaining doses with Pfizer or Moderna to fill in that gap so visitation can be restored sooner? Secondly, at the rate of vaccinations we're seeing this week, you mentioned this, it'll be, based on our math, at least early July before we hit the goal of 2.5 million people at least partially vaccinated. Can you talk specifically about your plans to speed that along, if you have plans, since the incentive to rescind business restrictions doesn't maybe seem to be working in the way that you had hoped? What are additional incentives that you're considering? Thank you.
Well, I don't think it's our goal that's not working in the way that we hoped. We're seeing across the country a major drop-off in the number of Americans eager to get vaccinated. It's happening everywhere. It's happening a whole lot more to our south and even to our west. We are working every angle that we can think of. We will be announcing some other initiatives that are coming out soon. We're reaching out to others, but what we really need is community leadership that we've been asking community leaders directly for. What we need is people's doctors reaching out to all of their patients. What we continue to see in the polling and the other information we get is that we now need those individual relationships to come into play. And I can ask, and I am asking for all those. We then need people to take those and put them into action. I certainly think we'll hit our goal before early July. And then we're also seeing some additional science that's coming out that may let us ease some other things that we have in place out there before that. And like I said last week, if we need to incrementally ease as we get towards that goal, we can. But that's certainly a goal where we get to do a major action and a major step. I've got a call with a large number of businesses tomorrow, and there should be a lot of encouragement coming from that direction too. So we're going to continue to work on those plans. What was the other question, Jay? Oh, the state corrections institutions, we were already at 70% before we had to pause for J&J, and that's without 2 facilities that had recently had an outbreak where we couldn't start. So we were actually getting a great response there. And we do want to see what Johnson & Johnson says tomorrow. We may be able to go ahead and fully resume that. If there is any further pause, we will look at Moderna and Pfizer. Obviously, it's a bit more of a logistical challenge for a number of reasons. Or if we have a significant number of those in the facilities that are concerned about Johnson & Johnson, we'll look at that opportunity. We certainly have the doses, and we want to make sure that people, especially in a congregate setting, get them. I am heartened by that uptake. We also, in our Shawnee project in Louisville, are seeing some positive signs based on efforts that we're putting in that we may be able to take and replicate across the state, where we have a call center directly reaching out to people. We had more vaccinations this last week at that location in the school than the week before, one of the few places in the state that is going up. These 2 FEMA sites are hub and spoke models, so we'll have vans going out in the community. We're also working on a fleet of additional mobile units and working with county judges and mayors to put them in as many places as we're going to have people. We're really going to have to get to the point where if there's going to be a festival, there's a tent where you can get vaccinated. If there is a big sporting event, if they'll let us, there's going to be a tent where you can get vaccinated. If you're going to the grocery store, there's a spot where you can get vaccinated. If you're going to pick up your prescription drugs, there's a spot where you can get vaccinated. We're just going to have to continue to encourage, but also provide more, easier access than ever before. What I hope doesn't happen is that we have a spike in cases, and that's what pushes people to get vaccinated. Debbie Yetter from the Courier-Journal.
Hello, Governor. If regarding the nursing home involved in the CDC study, if the facility didn't do anything wrong, why not identify it? And secondly, I don't understand the reason for confidentiality, since every nursing home in Kentucky that's ever had a case or death is listed on the website by name.
Well, I'll check with our folks on that. I think it would be there would be an ability to potentially identify specific patients, but Debbie, I'm willing to check with our attorneys at Public Health on the personal information piece on it. I will tell you, I don't know the name of the facility, but I know that our Department for Public Health does. Melissa Patrick from Kentucky Health News.
Hi, Governor. So just tagging off John Boyle's question, have you considered requiring vaccines among our long-term care facility staff, and why or why not? And the second part of that was, have you encouraged the companies, the long-term care facilities, to make that a requirement?
So we have encouraged the associations to get as many people vaccinated as possible. Have we reached out directly to the companies and suggested that they make it mandatory? I'm not sure that we have done that. We have certainly encouraged them to get people vaccinated. There are some legal concerns with making it mandatory, and certainly the federal government hasn't made it mandatory. And remember, so many of these are Medicare or Medicaid, and the federal government hadn't taken that step either. We're not going to make getting a vaccine mandatory in Kentucky, and I don't think that would help. You see what's going on out there just like I do, and making it mandatory, we might actually get less people getting it than it is right now. Listen, we got a complicated country right now where we've got people believing some of the craziest things from the internet that we could ever imagine. That makes it hard to ultimately bring people around, and it's going to take us listening and being patient, being compassionate, not getting frustrated, and there's no easy solution. And And, there's no one magic step that I can take or any other one person. This has to be an us. It has to be an us. One doctor to one patient, one friend to one friend. That's where we are. And so I hope us, and I think that includes the media too. This can't just be a reporting on what Beshear can do to get people vaccinated or what one of our hospital systems are doing to get people vaccinated. You all have the facts too, and we need your help in this. At most parts of this pandemic, we've all tried to work together to give people the actual facts with so much misinformation out there. And that's people in healthcare, that's local leaders, that's business leaders, and that's where we are now too. It's been a while since we've had to come together to do that, but the home runs, which were the days that every single appointment would fill up, are done. We got to hit singles and doubles every day until we can get our to our goals and to get everybody protected. John Charlton from WHAS. Well, maybe Andrea.
Hi, sorry, John.
on.
Yes, sir. Thanks, Governor. John had something come up, so I'm taking the slot for WHS 11. Want to circle back around to the auditor's report and the Inspector General's report that came out last week. What is the plan to reconcile those fraudulent funds paid and recoup the funds that were not collected as part of that Treasury offset program? Who has and who will be held accountable for those? And then a different topic, but interested in what percentage of the positive COVID tests are being sent for additional genetic testing? And does the state labs have the ability to identify those variants? And is there a plan to ramp up testing for those variants?
Well, I'll let Dr. Stack respond to the second one. There are multiple pieces on that first question. Certainly, we have taken actions against state employees that wrongfully looked at their own claims, some of which shouldn't have been made whatsoever. That is a dereliction of duty. That's taken advantage of your position. That's why I ordered our Inspector General, long before anything else, to look at it. We published that report. We took action. You cannot do things like that, and we're not going to tolerate it. One of the pieces of the auditor's report was about waiting on collections. They mentioned the Treasury. Part of that were the overpayments that we've talked about a number of times, where people, through no fault of their own, had slight overpayments. That's happened all around the country. Most places were able to waive it immediately. We needed a legislative act to waive it here in Kentucky. If we had ramped that program up like the auditor says we should have, we would have been going after people that didn't know that they'd been overpaid, that probably had already spent that money, and that our state legislature said, you can't do that. Democrat and Republican, that said, we want a chance to address this. And so what the auditor's report is suggesting is a lot of people out there would have been receiving collection notices that I think we all agree shouldn't have been sent out. Now, certainly we're ramping up those other collections that need to, of wrongful payments of people that have claimed wrongly. But remember, we have a certain number of people, and we can be processing people's claims that desperately need it. And I've answered questions, rightfully so, on how many people are still out there waiting. And then we have these other actions with the same people that either work on one or work on the other. So yes, we've prioritized getting people their benefits at times over going after people that may have wrongfully requested them. But that's still a decision I'd make to help those that need it the most. We're going to get both done, but at a time when people are struggling, I wanted to make sure that we help people first and foremost. Dr. Stack?
Thank you, Governor. I think, as I understood it, the question was about increasing testing to find variants. And if that's correct, then we do need to increase that. That's a recognized challenge for the nation and actually globally. We do need to increase our surveillance abilities to check using this fantastic technology of genetic sequencing to find out when these viruses are mutating, when they're becoming more dangerous or are able to circumvent the protections of vaccines or other measures. That being said, I think we mustn't be cavalier about the substantial investment and effort that requires. Running a genetic sequence on this virus takes over 3 days in the typical lab. And then you have to do the bioinformatics analysis, and they build these massive databases where you've got to track all the different sequences and slot them into the right place and categorize them. Now remember, we do some of this at the state lab, then private labs do it, and the CDC does it, and the CDC is contracted with private labs across the country to do it across the country. And all of these different sources feed into these big data systems. So there is a lot of surveillance going on, but it's not enough. We need to do more, but we also need to be thoughtful about it. So where we really focus is if there's a nursing home outbreak, if there's a cluster in a certain work environment, if there's a population of folks who were vaccinated and got infected, we focus it where the yield is the highest to try to do detective work and figure out if there's something unique about that circumstance. So yes, there's more to be done, but where we are is still progress, and we're continuing to make more progress with each passing day.
All right, next up is Chris Otts from WDRB.
Thank you, Governor. If I understood Ms. Cubbage right, I think she said 102,000, maybe it was 104, had gotten back into their unemployment accounts since the system was reset last week. And I recall there being about 300,000 who were mailed new PIN letters. I just checked a couple of times before we came on and during the call. I called the call center and it hung up saying that it's too many, all agents are busy, try back again later. So if only a third of people have regained access to their unemployment accounts and this call center is not going to be operational after, I think she said, a few more days, then what is the plan for people who still need help getting their PINs or getting into their accounts? I'm hearing some feedback. I'm not sure why.
You're hearing some what? Okay, we got your question. Amy?
The call center is still going to be operational. It's just not going to be PIN only. And in fact, right now, I hesitate to call it a problem, but over 50% of our calls right now are not even PIN related. It's people calling for other reasons. So at least through Sunday, we're only taking calls for PIN resets so we can prioritize those. But people who are having trouble with what they've gotten in the mail will still be able to call in starting on Monday. It's just will be opened up for broader services then. Oh. Yes, they went out in waves. So if you were in the last wave, we prioritized people who we know are currently claiming, but all of those people may not be currently claiming. Those were people who still had weeks they could claim, but if someone has gone back to work and is not claiming, we don't know that. They don't affirmatively tell us. So they may have weeks, but are not actually needing to get back in the system. So we don't actually expect all 300,000 of those people to create new accounts.
And finally, we've got just a couple of questions here from Leo Weekly that on April 9th, I set out some remaining concerns about Churchill Downs infield. If you're going to the infield, first, get vaccinated. And second, once you're there, follow the rules. I know Churchill Downs is going to have a number of individuals walking around, making sure that people space out and wear their masks. As we know what the infield normally is, and it can't be that this year. So we need those that are going to be responsible, to make sure that they follow each of those rules. And let's make sure that the Kentucky Derby is as safe as it can be. Does it go beyond the state's requirements? I think it right now it looks like from a capacity standpoint, Yes, in that they're focused a lot on different areas on the distance that you need between different parts. But plan's good. How we all act when we're there, and I'm going to be there, is just as important. This is an event that, if we follow all the rules, can be done safely. And it's incumbent on Churchill to enforce them, but it's incumbent on everyone that's there to do so as well. I hope people view this as a partnership for something that is so important for this state. The Kentucky Derby is a time when the eyes of the entire world look to us, and we can show them something positive. Let's make sure, if you're there, that you know if the world's cameras turn towards you, you're doing the right thing. One worry is that residents of Louisville are COVID variants, and the fact that people are coming in. Should I be worried about the potential proliferation of variants? If you are vaccinated, we believe you are protected, significantly protected against most of these variants. We already have every variant of concern in Kentucky. Because of that, I don't necessarily think we will see more. Any major event, if not done the right way, can add to the spread of COVID, but I think we have a good plan here. Anybody who's concerned about the Derby, go out and get vaccinated yourself and encourage other people to do so. It's the very best way that we can ultimately protect ourselves from everyday activities and the ability for this to spread. All right, I appreciate everyone's time. Next week, we're going to do Monday at 4 p.m., but then we're going to do Thursday at noon. And going forward, it looks like Thursdays will be at noon, at least for a couple of weeks. We're trying to change our schedule a little bit to make it more accessible for those that still want to tune in and get information directly. And so we're going to try to be providing that information in the best and most accessible way for you. We as a state can do a lot, but we've always believed in personal responsibility in this state, and that's how we have to be viewing this vaccination effort. We really need everybody to get informed. If you actually read this information, you read the science, you will come to the conclusion that this thing can protect you, the vaccine, and it is safe and effective. We'll continue to do everything we can to encourage and to provide access. And to everybody out there, we need you to be our advocates. Talk to those around you. Let's do this. Let's win this together. The light at the end of the tunnel is getting closer and closer. We can get there. Thanks.